Good afternoon, everyone. My name is Mark Steer. I'm the Executive Director of the Pennsylvania Policy Center. I want to welcome you to our Federal Policy Action Call. Pennsylvania Policy Center does two of these calls a month, one focused on state issues, one focused on federal issues. Normally the federal one is first, but because of the state budget, we did the state budget one earlier in the month, and today is the federal policy call. We're going to be talking about some very important issues today, and I'm very grateful that we're joined by a bunch of experts on these issues. The fundamental question is the impact of the One Big Beautiful Bill Act, otherwise known as the ugly, horrible bill, the reconciliation bill passed by the Congress in early July on the state. We're going to look at a general perspective on that bill. We're going to look at the impact of that bill on healthcare costs. And then we're going to take a look at the impact of the bill on hospitals in the state. We have a number of speakers. We'll start off with Francisca Sepulveda from For Future. Uh, I'm sorry. I'm blocking what FOF stands for.
Yeah, for future
Or
Pennsylvania.
Pennsylvania. Okay, sorry. Then we're gonna be Rochelle Fortier, the Executive Director of Affordable Pennsylvania, will speak. And on the third set of issues, Patrick Keenan, the Policy Director of the Pennsylvania Health Access Network, and State Representative Dr. Arvind Venkat will speak on those issues. So without further ado, I'm going to turn this over to Francisca from For Future.
Awesome. Hi, everyone. My name is Francisca Sepulveda. I am the regional organizing director for Future. So my region is the what the beautiful will, if
Sorry, Francesca, we're having a tech problem. We're having trouble. Your line is breaking up. Try to see if we can get you connected again. Mark?
Yeah, I wasn't sure if it was my internet or hers, but yeah. Why don't we go on to the second speaker, Rochelle Fortier of Affordable Pennsylvania, and we'll come back to Francisca when we can get her back on the call.
Hi, everyone. Good afternoon. Thank you so much for being here. As Mark said, I am the director of Affordable Pennsylvania, and we work to ensure that Pennsylvanians are educated about where their members of Congress stand on issues that impact their bottom line. And so I'm happy to be here to talk to you today a bit about, some of the rising costs that we're seeing, particularly around healthcare, as impact from as Mark mentioned again at the top, the one big terrible bill, the Republican tax and spending bill, and also touch a bit on the upcoming government shutdown deadline and how that is also impacted by this bill. I saw that Francisca hopped back on. Are we still? Should I keep going or?
Why don't you keep going, and then we'll go back.
Okay. Well, Francisco was going to do a bunch of setup to talk about, to explain a bit more about the bill, but I can touch on it a bit. But so talk about the cuts for the One Big Beautiful Bill Act. But so for those of you who don't know, Republicans in Congress passed a bill that was, President Trump's tax and spending priorities, which is going to make devastating cuts to programs like Medicaid, supplemental nutrition assistance programs, SNAP, and several other programs that folks rely on to lower their costs when it comes to energy tax credits, et cetera. And this was all in service to pay for tax breaks for billionaires and wealthy corporations. And so what we are seeing is that there are hundreds of thousands of Pennsylvanians that are at risk of losing their healthcare benefits, that are at risk of losing their ability to help their family put food on the table. I know a bit later on in the program, we're going to talk about hospital closures. There are several hospitals in this state that rely on Medicaid funding to keep them solvent. There are, grocery stores, food and beverage purchases. These are very small margin kinds of companies. 8% of those purchases across our state are paid for with SNAP. So it's putting all of this at risk and really raising the costs of regular families like you and I just to give these billionaire tax breaks. So what I was going to talk a bit about also is this upcoming government shutdown deadline. For those who don't know, our federal government's fiscal year starts on October 1st. So at the end of this month, September 30th, is the deadline for Congress to pass the budget bills for fiscal year 2026. It is a very long, complicated process. There are several appropriations bills, 12 of them. They have not passed any of them. So we are approaching this September 30th deadline without the appropriate bills passed to be able to fund our government. So right now, they are looking at passing a continuing resolution, what you'll hear referred to as a CR, that would extend the current spending plan, push that deadline back so they can keep working on the federal budget. The Republican plan for their continuing resolution would continue these harmful healthcare cuts that are raising costs for people, particularly for folks who don't have health insurance, who struggle to get health insurance. And we are calling on our members of Congress to not support any continuing resolution that does not restore these cuts to healthcare. And Republicans are willing to shut down our government in order to keep these cuts in place to pay for tax breaks for billionaires. And so we do have a couple of upcoming activities in a couple of key districts where we're going to be taking constituents directly to their members of Congress to let them know that they don't want them to support any kind of government funding bill that does not restore these devastating cuts. And I can talk a bit more about that later. But I think our call to action around this impending government shutdown right now is to tell your member of Congress to not support any continuing resolution, any government funding bill that does not restore these devastating cuts to healthcare. Yeah, and I will pass it back to you, Mark. Mark, you're on mute.
I'll pass it back to Francisca for her presentation. Sorry, we're going a little out of order, but we've had some technical difficulties.
All right, is everything working? I'm so sorry. I will try again. Okay. What, second time's the charm, I guess. Can everyone see that? Is it good? All right, awesome. So I will be quickly going over just the main things that are being cut. So every time you see the OBBBA, that means the One Big Beautiful Bill Act. Beautiful in quotes because it is not that at all. It is pretty terrible. It cuts Medicaid, Medicare, it cuts SNAP, and it cuts a lot more, but I do not have the time to get into all the details of it. But the major thing that it does is it's cutting all these important programs, these life-saving programs, to give tax cuts to the ultra wealthy and corporations. So first off, Medicaid. Medicaid is under attack. It doesn't, it buries people under red tape. It is requiring people to renew, to fill out proof of work requirements, both at renewal and when they apply for Medicaid. Folks who qualify under the Affordable Care Act expansion will be required to submit proof of work requirements every 6 months when it used to be annually. Why are they doing this? Why are they making it so hard for people to get Medicaid or even stay on Medicaid? It's simply for that purpose, to make sure that people don't have it, to make it as hard as possible for anyone to ever, be able to have this life-saving insurance. Medicare. There will be cuts to Medicare. That is simply because it will the OBBA will add trillions to the national debt, and that will automatically trigger a $490 billion cut to Medicare. So currently 70 million people who are on Medicare are now at risk of losing their coverage or having their coverage not be as good as it used to be. So most things won't be as covered as it used to. It also reduces access to Medicare for lower income beneficiaries by making it harder to enroll in Medicare savings programs. It's happening. And then there's tax cuts, again, for the billionaires and the corporations. So they will slash, why are they cutting all these programs? It's simply to justify all of their tax cuts for the ultra wealthy. So the tax cuts will include a permanent extension of the 2017 tax cuts. Again, that primarily benefit wealthy earners and corporations. The corporate tax rate, it keeps like Rochelle mentioned earlier, it keeps the corporate tax rate at 21%, which is a significant decrease from the pre-2017 rate of 35%. It lowers taxes on foreign profits of U.S. corporations. So again, there's not going to be as much money coming in taxes to help fund all these, again, life-saving programs. And it's also allowing more generous interest deductions. So one of the I've heard on the field, many people talking about how they're excited that there will be no taxes on tips. And while yes, this is true, there are no taxes on tips, or and there have been some cases, depending on like how long you have overtime, you won't be taxed as much for overtime. However, that is like a drop in the bucket compared to the amount of taxes, the amount of money that the ultra wealthy would be coming in from these tax cuts. So we cannot, get distracted. There are so many people who will be losing their healthcare coverage, people who desperately need help. SNAP, food assistance, resistance, insurance, and so we have to have this whole comparison. So these tax cuts disproportionately benefit the wealthy and high income earners and families at your expense. So not only are we not getting parity tax cuts compared to the wealthy and paying more in taxes than wealthy earners and corporations, but our friends, family, neighbors, communities, and maybe even ourselves are at risk to these cuts to the social safety net programs. So how does this impact Pennsylvania? So the bottom line, you have to remember, this is the amount of people who will be affected by all these cuts. There's 2 million adults and 1.4 million children that rely on Medicaid. There's 316,000 seniors that are on Medicaid. There are 2 million Pennsylvanians that depend on SNAP to afford groceries. Medicaid cuts could cost the state 49,000 jobs and wipe out $5.3 billion in economic activity. This is a huge deal. So because of how big this bill is that passed, because of how much it's going to harm specifically Pennsylvania, but not just the state, the entire nation, we need to all work together to get people to know about this. Because again, I've heard in the field, people love the no tax on tips. They will not love everything else that comes with this, but they just don't know that. So we have to be keep doing stuff like this, keep getting the word out, getting people to understand that this is the amount, this is what is at stake. Make sure you talk to your representatives, your senators on the state level and congressional and federal level. Talk to form your own mutual aid groups. Like, just get involved in the community so that the community can talk about this. So that is it for my presentation. I so sorry for the internet interruption. It always happens when you need it the most. So thank you again so much. And I will pass it off to, I believe, Representative Venkat.
Yes, we're turning it over to Representative Arvind Venkat and Patrick Keenan of Pennsylvania Athletic Network. I'm not sure which one of you is speaking first, but you go ahead.
Patrick, you want to go ahead?
I always defer to you, Dr. Venkat.
All right. So hello, everyone. Thank you for joining today. My name is Arvind Venkat. I'm the state representative for the 30th Legislative District in the North Hills suburbs of Pittsburgh. I'm also a practicing emergency physician and the first physician to serve in the Pennsylvania legislature, House or Senate since the mid-1960s. I have been raising my voice about the challenges from the Big Ugly Bill since the moment it was proposed, and certainly since it unfortunately was enacted into law. I've practiced medicine for 25 years. That's when I finished medical school in 2000, and I have never seen a more direct attack on the health and well-being of our community as this legislation. And I don't say that lightly. As Francisca pointed out, it is perfectly designed like a guided missile to take out healthcare from hundreds of thousands, if not millions, of working Pennsylvanians. And it does so in a number of ways. The planned Medicaid cuts and the planned food assistance cuts are directly tied to creating paperwork that is meant to drive people crazy and lose coverage. And this is an empirical fact. It's been shown when work requirements were rolled out in Georgia and Arkansas, it did not increase employment. It caused people to lose coverage, and it caused people who were eligible to still be on the program to lose coverage. And yet, with that terrible track record, that's what this legislation did. It also did not renew the premium tax credits under the Affordable Care Act, and that was mentioned in one of the comments. And this is coming to a head right now and is one of the reasons why Democrats in Congress are saying that they will not support a budget that does not renew those tax credits. There are 500,000 Pennsylvanians who are obtain insurance through the Affordable Care Act through Penny, the Pennsylvania Insurance Exchange. It's estimated that up to 200,000 of them will decide not to take coverage because premiums are going to go up for them by an average of 82%, if not higher. And that altogether, the Medicaid cuts, this failure to renew the premium tax credits could result in anywhere from 500,000 to 1 million Pennsylvanians losing their health insurance coverage out of a population of 13 million. And that then relates to all of us. I'm an emergency physician. It's not that the uninsured don't seek care. It's that their care is not compensated for and that we all pay for it in whatever form of insurance, if we have insurance, that we have. So what does this mean for hospitals and access to care? as has been rightly pointed out, Medicaid is a significant payer in the hospital system, and it is across the board. And we've seen a number of hospitals close in this state directly related to poor finances and poor financial management because the cost of care is not covered by reimbursement. And this bill will make it worse. Over a 10-year period of time, it's estimated that up to $10 billion in funding for hospitals in our state will go away. Now, you will hear our Republican friends tout this $50 billion rural healthcare transformation fund. First of all, there's no detail as to exactly how that money will be used. Second of all, it's not all coming to Pennsylvania. You don't have to do the math, or you don't have to be a math genius to understand that $1 billion, 1/50th, what we might anticipate over 10 years, is a hell of a lot less than $10 billion. And so that combination means that hospitals already across the country are closing services and closing clinics and are planning to, if they can't avoid it, will close their doors. And the last thing that doesn't get mentioned about a lot about the bill, but it's important to highlight is the bill is going to implement cost sharing for those who are the working poor between 100 and 138% of the federal poverty level. That means that if patients have Medicaid, they are going to end up, avoiding necessary care and flooding into emergency departments, which is one of the few places that the bill says that you don't have to pay money in order to seek care, unless it turns out when you come to an emergency room, you have a non-emergency condition. So if you came in with chest pain and I work you up and I say, it's not a heart attack, by the way, come and pay this copayment after the fact because you should have self-diagnosed yourself. Republican U.S. Senator Josh Hawley calls this a sick tax. That's how bad this idea is, that someone as conservative as Josh Hawley feels this way. And that combination altogether is going to jeopardize the healthcare infrastructure in our state. And most importantly, it's going to cause people to die. Because when you lack insurance, when you lack access to care, you don't seek care when you need it, and you die as a result. And I have personally seen patients in that circumstance, and I know that I will see more. So in terms of what you can do, I think seminars like this are really important to raise awareness. There needs to be concise messaging across the board to say that we did not vote to make Pennsylvanians sicker, to make them poorer, to make them die, and that elected officials who support these type of policies need to face consequences at the ballot box. And that has to be the message moving forward of how devastating this bill is. So with that, I will turn it over to Patrick, and happy to answer any questions if we get to the Q&A here.
Sure. Thank you, Dr. Venkat. I just want to, everything that Dr. Venkat said outlines perfectly that missile that's targeted right at the healthcare system. And so I just want to kind of backfill with some of the numbers that we've been doing here to look at the impact by congressional district across the state. So as Dr. Venkat said, we first have a problem with the number of folks that will be uninsured because of the changes to Medicaid and Penny, Pennsylvania's Affordable Care Act marketplace. We're going to see nearly 600,000 Pennsylvanians lose coverage in the next couple of years due to the changes that are in that bill. And as Dr. Venkat mentioned, when they don't have care, they do show up in the emergency room and often sicker than they otherwise would have been. That's creating $707 million a year in uncompensated care to Pennsylvania hospitals. That's spread throughout the Commonwealth of Pennsylvania. And ultimately, what it means is that everyone, even if you're not on Medicaid or on Penny or on the programs that are being cut, will end up paying more money. So I think as we're having conversations in our communities with our family and friends about this issue, the fact that hospitals will see individuals walking in their doors sicker than they otherwise would have been, who won't have access to their medications, who won't have access to primary care doctors because of these cuts, and end up needing to be treated in the ER, all of those costs will be passed on to everyone in Pennsylvania, because the hospitals have to keep their lights on. They have to keep their staff employed. They have to provide the services that they need to provide. And we also know that the ER is not the place where people should be treated for common conditions. You shouldn't have to find out that you have a cancer diagnosis in the ER, or be treating uncontrolled diabetes that could easily be managed by a doctor. We know that there's going to be over 2,600 deaths due to these changes in Pennsylvania in the upcoming years, because people simply won't have access to the care that they need. This creates kind of the perfect storm for Pennsylvania hospitals. In addition to the uncompensated care costs, Dr. Venkat pointed out that many hospitals are going to see additional reductions in the Medicaid funding that they receive. So not only are they seeing patients for which they previously would have been paid and no longer, and those patients will no longer have Medicaid or penny, but the state is facing $20 billion over the next 10 years in cuts to its Medicaid program through changes to what we call provider taxes. And the simple impact is that this is a perfect storm for our hospitals across Pennsylvania. Not only do they see people that they're not receiving a payment for, but they also are going to see a reduction in the amount of payments that they receive for the care for people that are covered. And we suspect, based on kind of looking at the changes proposed in the bill, that there are over 47 hospitals across Pennsylvania that are going to be affected by the changes that are proposed in this bill. So, in summary, because of these changes, what do we see? We see a large number of uninsured. We see hospitals that are at risk, a large number of deaths. And ultimately, we have an unsustainable and unsafe set of situations for communities all across Pennsylvania. I do want to just amplify what everyone has been saying about the advanced premium tax credits. That Congress had the opportunity to extend it. They didn't. We still have one last opportunity before Penny and the Pennsylvania Insurance Department finalize their rates for the upcoming year. As was already mentioned, 90% of folks enrolled in Penny are going to see these sharp monthly premium increases. Basically, they're going to see their premiums double. And if you're, an older group of folks, if you're, a couple 60 years of age in York County with an income of 82,000, so you've worked your whole life, you've saved, it's now the two of you, and you're purchasing insurance through Penny. The premiums are expected to go from $586 a month to $2,976 a month if we don't see these premium extensions. Absolutely unaffordable and unattainable for folks to be expected to kind of pay those kinds of premiums. So for everyone in general, we're looking at about a doubling in premiums, but for those folks, it can go as high as 4 or 5 times the normal cost. So I really think that all of our energy at the moment in this federal budget fight needs to be focused in on getting the enhanced premium tax credits extended. And we're happy to share the numbers that we've shared in the follow-up to this call. I'll send them on to Mark and to Jeff.
Thank you all. This has been a great presentation, very useful information. It's actually, I'm someone who's often presenting this information, and I've been very impressed by how well you all did it and boiled it down into very simple but incredibly powerful ways of understanding the problem. I'm going to see if there are any questions from the audience. I have a couple of things I would add, but let's turn to questions first. Let's give the people here a chance. If you would just put your question in the chat, I will read them, and we can have people on the call speak to them. Okay, while we're waiting for a question, I'm going to make an observation to see if someone on the panel um, wants to address it. When I hear people 60 years of age seeing their insurance premiums quadruple and realize that many of them are not going to be on um, um, will not have health may not have health insurance. And I hear about people who, many of whom are elderly, losing Medicaid. I'm thinking about what is that going to mean for Medicare costs? Because my understanding is that Medicare costs for the federal government actually were reduced because people were getting to the age of 65 and were healthier because of the Affordable Care Act. What's going to happen to Medicare costs if these cuts go through?
Yeah, I mean, I'm happy to comment. It's all a matter of how interrelated this is. We depend on having a broad-based pool of individuals who are insured. You know, the Affordable Care Act did wonders in terms of coverage, but what is not mentioned is that it has bent the curve on healthcare costs. It still outpaces general inflation, but it is less than the trajectory it was before the Affordable Care Act. And that's largely based on having a broader pool of insured individuals. As Francisca pointed out, this legislation under federal law is going to lead to Medicare cuts for sure. And the cost of care is going to rise. And there are other issues that are contributing to this. The attacks on immigration means that the healthcare workforce is far more strained than it has been in the past, and that is going to drive price pressures within the healthcare system as well. Tariffs are also driving price pressure. So this is pretty much a perfect storm. If you were looking for a deliberate way to sabotage the ability to have affordable and accessible healthcare, you could not do much worse than what was done in this legislation.
And I just want to say, what people often don't realize, and what is really common for most working class Pennsylvanians, is that they rely on these programs at different times throughout the course of their life. So it's not just, people of a certain age relying on Medicaid or people relying on Penny. Here at the Pennsylvania Health Access Network, we help thousands of folks every year that are cycling between the programs because they've had a change. They've picked up another job and now they can, qualify for Penny, or, they lost a job in this economy and they have to rely on Medicaid. So all of these things, this system is connected together, and that drives what Mark was talking about the lower cost for the Medicare program. And ultimately, this is a matter of life and death for a lot of folks. I think that in addition to them being sicker when they get to the Medicare age, some folks aren't going to make it because of these changes. These changes are designed to cut people from programs that they use to keep themselves healthy, to keep themselves going to work, to keep chronic conditions like asthma or diabetes managed, and to avoid really serious conditions like cancer, or catch them as early as possible. So what we're going to see is that people will have, because so many small businesses across Pennsylvania don't have the option of providing health insurance coverage because it's so costly. Many folks, are going to be lucky to make it to the Medicare age if they can, go without treatment because, the health coverage has been cut.
Thanks, Patrick. I'm going to give you a little concrete example, my own. Like a lot of people in their 60s, I've had high blood pressure for a number of years. It's been treated, it's been under control. Suppose I didn't have health insurance and I couldn't get that treated. I might have much more serious heart problems than I do now. My injection fraction's great, but say I had a heart attack, had some heart damage. Then I'm entering Medicare at 65. I get healthcare there, but it's a lot more expensive to treat me after all the heart damage I've might have had if I hadn't been getting healthcare all these years. Um, as Dr. Venkat said, these systems are integrated, and as Patrick Keenan said, people go from one to another, and we need an integrated system so that people never fall through the cracks. And one way to look at what this terrible, ugly bill does is that it's created lots of cracks in the healthcare system. and that's going to affect people in different stages of their lives at different times. And those cracks and the people falling through them will reverberate throughout all of these systems and make them all worse for everyone. So we've
There's a
talked about
question
the
in the chat about funding from the state. And so I do want to call attention to one of Dr. Venkat's colleagues, Representative Dan Frankel, the Democratic chair of the House Health Committee, is in the process of introducing a bill that would kind of take on the challenges that were going to be faced by Medicaid work requirements. So as everyone has pointed out, this isn't about work. Most people on Medicaid are already working or have a very valid reason for not working. There's really only about 4% of the Medicaid population that's looking for work and doesn't qualify for an exemption. But this is about creating a lot of paperwork barriers so that people kind of get caught up. And as Dr. Venkat pointed out, in other states, huge coverage losses. This is a failed idea that has now been enacted in law. It's failed in every state that's implemented work requirements. It has nothing to do with helping people get work. And in fact, under this program, people either work or they're cut from coverage. There is no kind of assistance to kind of help meet their needs. So I will point out that Representative Frankel has put out a co-sponsorship memo to fund, get additional resources to the Department of Human Services to educate folks, and then also to make technology changes that can make it I mean, it's a burden, but as easy as possible for people to comply. And also included in that co-sponsorship is funding for community groups across Pennsylvania to be able to work in their local communities to help people navigate what is a complex system. Obviously, Pennsylvania can't undo the harm that it's been done. We need our federal lawmakers to reverse these harmful changes. But we do, support Representative Frankel and other colleagues in the House that would be looking to make this as easy as possible in a very difficult situation.
Yeah, and I'll just add. So first of all, I support Chair Frankel's bill. I'm a co-sponsor of the legislation. But like I said in the chat, the amount of money that is involved means that we at the state level cannot make up for the premium tax credits. We cannot make up for the Medicaid costs that are involved. I mean, what is cynically not pointed out in the federal legislation is that the cost that it imposes on the state to administer requirements means that more funds than you would expect are being pulled away from supporting people in need to be on Medicaid itself. So we have to administer these programs, and there isn't an unlimited number of dollars that go along with it. The other part that is very cynical, and it's worth pointing out to our Republican friends, is that when they put forward the so-called score on this bill, it was based on creating savings in the Medicaid program. So for all the talk that, no one's going to lose their Medicaid, we're just trying to get rid of waste, fraud, and abuse, the only way people save money under the Medicaid program is if people lose their insurance and don't expend costs under the Medicaid program. That's it. So it is the height of cynicism to say, on the one hand, we're not taking care away from everybody, but we are also happy to claim savings from taking care away from everyone. This is how bad this is. So there is not a good way for the state to do this. You may be aware we have not yet passed this year's state budget, let alone next year's, which will be far worse. And it's there's a real challenge here. And so that's why my honest answer is, short of raising state taxes to nosebleed levels, which I will say as a political figure, we are not going to do. The only real opportunity, I shouldn't say opportunity, the only real outcome is going to be people losing coverage and the costs that go along with it.
Thanks. We have a question in the chat from Kristen Volchansky. She says, speaking of Medicare, I saw that CMS is allowing a handful of states, a handful of states to utilize the practice of prior authorization for traditional Medicare. Could you elaborate on the impact of this practice? Is this something any of you are familiar with?
Yeah, so I'm a little bit familiar with it. Again, this is another barrier to put in front of in delivering necessary care. We've reformed the prior authorization process here in Pennsylvania, and for Medicare to start implementing prior authorization requirements really makes little sense unless you're trying to prevent people from seeking care that they need. And even the insurance companies feel that the prior authorization process needs reform and have come out to say that they're planning to get rid of, I shouldn't say get rid of it, or at least get rid of much of it, except in very particular circumstances. So I have not seen that it would directly impact Pennsylvania at this point, but suffice it to say that I view it with a pretty jaundiced eye in terms of what it would mean for anything positive in our state.
Thank you. I'm looking for other questions. Someone suggested, why don't we raise taxes on billionaires in Pennsylvania to try to fund some of the things that are being caught in this process?
Yeah, it's a great question. We are constitutionally prohibited in Pennsylvania from having any type of graduated tax. There's a clause in our constitution called the Uniformity Clause that basically says all taxes have to be flat taxes. And so I don't have the ability, whether I wanted to or not, to pass a tax on a specific class of individuals based on their income.
I don't want to take us too far from the healthcare issue, but Penn Policy Center will be suggesting a series of 4 different taxes that we can raise that are constitutional under Pennsylvania that we can use to raise money from many of the billionaires who are getting huge tax breaks from the federal government to help in this area and many other areas. That's we won't be releasing them for another month or so, and it's going to be a long process to get them adopted or even considered by the General Assembly. So I'd have to agree with Dr. Venkat. There's no short-term solution for Pennsylvania to step up, replace what the billions of dollars that we're losing from the federal government. Any other questions? If not, I'm just gonna give some people some new information that I just got about 45 minutes before I got on this call. Democrats in the House and the Senate have introduced a funding bill, an alternative to the Republican continuing resolution. Now, what's been going on, as Rochelle said, is that Republicans have proposed a continuing resolution that would continue funding the federal government through the 3rd week of November. It would fund it at current levels. Democrats do not need to vote for this in the House if all Republicans vote for it, but because of the filibuster, they need 8 Democrats in the Senate to vote for it. The Democratic proposal that just came out this morning says a short-term continuing resolution through the end of October must contain the following things. It must reverse some of the healthcare cuts in the big ugly law. It must permanently extend enhanced tax credits for the marketplace or exchanges under the Affordable Care Act. And in a number of different ways, they want to ban the president from freezing funding that Congress has passed and the president in either a budget resolution or a continuing resolution or an appropriation bill that the president has signed. It's not clear what's going to happen this week in Congress. The Republicans proposed to move this bill, their continuing resolution, by the end of the week. Unless Democrats in the Senate, 8 Democrats in the Senate agree, it will not pass the Senate. And that could mean that we're looking at a federal government shutdown. I know there are a number of people who are very concerned about a shutdown. Our own Senator Fetterman has said he's going to vote for the Republican continuing resolution to avoid a shutdown. Our view at Penn Policy Center is that it's certainly worth the risk of a shutdown. It's certainly worth going through a shutdown to get the enhanced tax credits for the exchanges, to get some reversal of the Medicaid tax cuts, and to ensure that anything that the Congress does pass it cannot be unilaterally changed by the president. We will be sending out emails to people on our list later this afternoon with some talking points about this bill, and with links to an action page that you can all use to contact your members of Congress and your two senators, Senators McCormick and Fetterman. And I would urge you to take action on this and to share these emails with other people, ask them to do so as well. It's not clear we have all the Democrats on board with this plan. We certainly, as I said, do not have Senator Fetterman on board with this plan, but I think many of us here would agree that we actually need to get Democrats to stand up and fight for healthcare because of the horrifying cuts that we've all been talking about today. Any thoughts on that subject or anything else? If not, we can thank our guests for joining us and giving us so much important information about this the impact on healthcare of the bill, the reconciliation bill that Congress passed, and thank all of you for joining us, and hope you have a good day. Take care.